Hello, I'm Robert. Welcome to my channel. I've just signed the World Health Organization Declaration for Vaccine Equity and encourage you to do the same if this is something that you care about. And so the health workers around the world, they've all faced the same problems that they've had in the developed countries. And right now, many of them are putting their lives at risk without a vaccine. And this is just basic ethics that we should support that everyone around the world, whether you're in Africa or in India or South America or Mexico, wherever you are, you should have the same access to vaccines if you're on the front line helping people with COVID-19 as we have in the United Kingdom and United States and the wealthier countries. And I'm in the United Kingdom, where the talk is all about how quickly can we vaccinate everyone and manage to get everyone vaccinated, and can we do it all by the summer, or when can we do it? And there's very little talk about how can we ensure that everyone in the world who is very old or who is a health worker can get a vaccine as quickly as possible. And this declaration is just saying, it's not saying to stop our own vaccination programs. It is saying to provide support for the rest of the world to be vaccinated at the same time. And then once we've vaccinated all the elderly and the health workers, to give some of our to consider donating some of our vaccines to help the more unfortunate, the countries with weaker economies that have not been able to secure fast oversupply of vaccine in advance. And this just makes sense. It's ethically sound, and it's also the wisest thing to do. For as long as people are dying and hospitals are overwhelming throughout the world, then this is a major issue for the world economy. And how can a country go back to recover its normal economic health until it's dealing in some way with these issues? So we are all in this together. And then if we vaccinate the world together, then we can stop the variants which are threatening to overwhelm. So it actually even directly affects the vaccines in your own country. That if the rest of the world is not vaccinated, then they are an incubation place for variants that can come and overwhelm your own vaccines. So it just makes sense that we should do this. We should give this some thought. And so here's the declaration, and it says, due to unprecedented scientific efforts, vaccines are now being distributed in more than 70 countries. But the majority of low and middle income countries, it hasn't even started, which is a catastrophe, because just as we've had the hospitals filling up and then the vaccines are coming to help, then other parts of the world, then they're filling up, but there's no prospect of the vaccines coming for some weeks or months. We are going to vaccinate everyone eventually, and we are going to vaccinate all the health workers and all the very elderly sometime this year all around the world. And no vaccine program has ever been as fast as that. But the way things are going at present, then the elderly and the health workers in other parts of the world are going to get their vaccine much later than they do in the United Kingdom or the United States. So if I look at this example here, for instance, then this is the projection for the global vaccine supply for COVAX, which is the only supply of vaccine for many of the poorest countries in the world, the weaker economies. And as you can see there, it goes up to 145 million in March. There'll be 236 million doses by April, and that's for they are supplying to 90% of the world. And then another way of looking at this, I'm going to go back to, which page is it? This one. Then if you were living in this a thatched village in Japan, which has these rather spectacular water hoses for putting out any fires in the thatched roofs, and they have a water hose festival every year where they test the water hoses. And if you imagine that one house in the village was to hog all the water hoses, and all the water hoses just were pointed towards that house and was able to put out the fire on that house only, then not only would all the other thatched cottages in the village be at risk, but that cottage would be as well, because a very fierce fire would get to it, even if it had lots of water hosing on it. Still, the fire would be all around it, and it wouldn't be safe. And this is an example. The particular example of using this thatched village is my own. I thought what would be a good graphic to illustrate it. But the idea of fire extinguishers in the global village, that is an analogy by Dr. Tedros in one of his opening speeches, where when a village is on fire, it makes no sense for a small group of people to hoard all the fire extinguishers, all the extinguishers to defend their own houses. And it's the same with vaccines. It makes no sense to hoard all the vaccines, and we will have plenty of vaccines in time, but look at the rate at which the vaccines are being delivered around the world. This is Israel, and they've got over 70% of their population already vaccinated. Where I am in the United Kingdom, it's over a fifth. United States, it's about 15%. And then look at Africa, it's 0%. That just can't be right. And this is an example. You can see the very dark ones. It's 14.48 for United States. It's 21.42 for United Kingdom. And no data. Many places no data. When there's data, they just aren't being vaccinated. So it says no data, but actually there's for Africa, most of Africa is just hardly having any vaccines at all so far, and many of them just haven't been vaccinated at all, or they've just had maybe 20 token vaccines or something like that. And this just is not right. And then if we go back here again, if we go to the COVAX Alliance, no, the vaccine market dashboard. Now, let me just scroll down for a minute. I'll bring up the vaccine, and I can go to that in a minute. The United States, which has a little over 4% of the world population, it has vaccines secured for over 20% of the world population. Now, eventually, Canada have already committed. Canada's way oversupplied as well. And the reason was because there were many different vaccine candidates and nobody knew in advance which of them would be approved. It's now they're all being approved. So the countries like United States, Canada, United Kingdom, where I live, we have already secured enough vaccines for several times our population. And in that situation, we can surely start thinking about offering some of those vaccines to other countries. And Canada have already said that it will give its excess doses after it's vaccinated everyone. But even after we've vaccinated just our healthcare workers and the very elderly, then we can consider giving some of our doses that we have to other countries. And then, as well as that, we can not just consider, we can also work to make sure that the other countries have the manufacturing capabilities in other countries, and we can make sure that they have support them in producing the vaccines, and support them also in buying vaccines, so that they also can ramp up their capability faster, just like we're doing, just like the United States is doing, just like Europe is doing. Then we can also do the same for help support the other countries. And this is not an act of charity of helping poorer people. This is an act of common sense and just being wise, as well as being ethical, and the sound thing to do. It's also wise because it's helping the entire world to be vaccinated faster and help us all to recover together, because we won't recover individually if the rest of the world is not recovering together with us, not to the same extent. So what else? And they're not saying don't get vaccinated. When you're offered the vaccine, get the vaccine. But we can wait our turn. And my client spoke from his own experience. He was in charge of Ebola, the fight against Ebola in the Congo, and he has not yet had the Ebola vaccine, because the vaccine which was developed later, originally they fought it without the vaccine, then the vaccine is still in very limited supply, and it's needed for the frontline health workers and the local people. And he did not consider himself to be a high-risk category for Ebola, so he has not been vaccinated. And so if Mike Ryan can wait his turn for Ebola and he still hasn't been vaccinated, then we can wait our turn just a little bit and continue taking care while we make sure that around the world that the deaths and the cases are falling rapidly. All the sickest and the most elderly and the health workers on the front line who are risking their lives to save their fellow human beings, that they get the vaccine. So that's the main point here. And they say it's possible if leaders make it a priority through the COVAX, and to share the know-how and scale up manufacturing. And let's go to the page of the, where's it again? Not that one. There we are, that one. Right. They have these lists of things to do. So the world leaders to increase their contributions to COVAX. Vaccine manufacturers to share the know-how. And also leaders to prioritize supplying COVAX over new bilateral deals. The COVAX, if we work together with COVAX, then we have a much more efficient way of producing the vaccines, because we're all producing vaccines for the whole world together. We don't have the running up of prices as a result of different countries competing with each other for the limited supply. We use the same chain for all the bottles and the vials and so on, working together. It makes much more sense than competing with the bilateral deals. And so that's their suggestion there. And that's about prioritising the distribution of COVAX. And then, where do they have the bit about vaccine manufacturers? They also say, I can't find it just now, but they talk about the need to share their, maybe they don't have that there. He certainly talked about the need for the vaccine manufacturers to share their data as well. So the World Health Organization can evaluate it fast. Sorry, click here, better way of doing it. Why is it not doing that? Control tab. There we are. That's the vaccine dashboard. So this is the, we've got plenty of vaccines we've got the capability to produce 20 billion vaccines in 2021. We have 10.4 billion doses secured, but only 3 billion for the COVAX facility. And that's the one that's for the most of the world. And then if I go and look here at the agreements, and it'll take a little while for it to come up, then there we go. You can see that that's the COVAX facility. And then you've got, and they've got enough for 27% of the weaker economies. They're going to be able to vaccinate by the end of the year. But the United States, which is only 4% of the world population, has enough vaccine, has more vaccine than COVAX. And you can see, but you can also see, if you look at the capacity diagram, then this is increasing hugely year on year. That's 2020, that's 2021 first quarter, second quarter, and then 2022. So we'll be able to produce enough vaccines, 30 billion doses of vaccines in 2022, and the same number in 2023. So the world has plenty of vaccine capacity. They do say that this may project a highly optimistic view of the potential supply, but you can still see that there's vast amounts. That 30 billion doses, even at 2 doses each, is enough to vaccinate the entire world about 4 times over. And that's what we'll have in 2021 by way of vaccine capacity. And some of the new vaccines will actually be easier to make, and it's not necessarily included in there. So let's see, what else have I to look at here? I talked about that. I think I've talked about everything. This is the world. I'll put all these links in the video description. This is the our world in data. They have a very good vaccine supply page. You can see how it's progressing in all the different countries. So we can expect the first doses from COVAX. They're going to happen very quickly. Where is this from? Sorry, I'm lost track. Oh yes. So here I've got the link to the Vaccine Equity Declaration. So look in the video description for that. And I encourage all of you to sign it after reading it and making your decision, as I just did. And hopefully we can get the world governments listening to us. And then this article in the video description, and towards the end of it, I have the transcription of the World Health Organization social media Q/A a week or so ago, where they talk about this in some detail. So I've got the transcription there, so you can have a read through of that. Now I've broken it up. The titles are mine, and I've broken that up. And so they see it that, and I think all of us need to examine ourselves and where we sit in that line, in that queue. And are we prepared to take 2 steps back in the line, just so someone else can step in front of us, because that's what it is. I think we're better than that. So if you can imagine us in a queue, and you're waiting to be seen for the vaccines, if it was actually queued up like that, and you were in a queue, and there were some very elderly 90-year-olds and 100-year-olds from Africa in this queue, and 80-year-olds, 90-year-olds, 100-year-olds, and you're maybe a young 20-something, and you know you're much less at risk, then would you, in that situation, many people would step back in the queue and say, you can go first, because you're much more in need of this vaccine than I am. And or else, if someone came to your queue and you're there, a doctor or nurse all dressed up for a COVID ward, and you say, well, you go ahead of me, you need the vaccine more than I do, So I think we all would have that human response if it was an actual queue of actual people in a line. And it's just because it's not in a physical queue and these people are in other countries. And then if you know that their hospitals are filling and people are dying and people are dying in their hospitals and the vaccines could have saved their lives, then again, I think many of us would say, well, I'm okay stepping back a couple of steps in the queue. Even if it means that I get the vaccine maybe a week later or something, I'm absolutely fine with that. I know how to protect myself, and these are people who are at very serious risk of actually dying, like a Russian roulette level of risk for the very elderly people of actually dying if they get COVID. And so anyway, that's it. Just think it over, and we need to pressure I think we need to pressure our governments and get this message across that the vaccines are for everyone, and to make just some of the discussion be about vaccine equity for the entire world, along with continuing to say how quickly can we manage to vaccinate everyone in the United Kingdom and everyone in the United States. There's nothing wrong with that discussion. But at the same time, how fast can we vaccinate all the elderly and health workers in the rest of the world, especially in Africa and the countries of weaker economies, and also to be thinking together about how quickly can we vaccinate the entire world, not just the United States or United Kingdom. They talk most of the time about how quickly can we vaccinate everyone in the United Kingdom. We should be talking about how quickly can we vaccinate everyone in the world, with the United Kingdom as part of the world. Not the United Kingdom and then world that we can help them a bit with their doses. The whole world has to stop this, and it makes practical sense for all of us as part of the world. We are discovering from this pandemic more and more how the entire world is interconnected, and that if we leave other countries behind, we are actually leaving ourselves behind, because the impacts come back to us, and we are actually putting ourselves at a disadvantage by not prioritizing and making it important that all the world gets vaccinated at the same time, or as soon as possible at the same time. The world has plenty of capacity to make the doses. That's not the problem. The problem is making sure that the supply is available to the countries that need it around the world. And if we really put our mind behind this, we could end 2021 with everyone in the world who wants a vaccine being offered it. There's no reason, no scientific, technical reason why anyone by the end of 2021 who wants a dose, why they shouldn't be offered one. And there's no reason why by the end of the spring everyone in the world who is elderly or who's a frontline worker, there's no technical reason why they shouldn't all be offered the vaccine before the end of the spring, before the start of the summer. And this is the world that we could be in. They will all the vulnerable will get it by the end of 2021, but the sooner the better, and the better for the entire world. So anyway, that's my video, and hopefully I'm doing my bit to help the World Health Organization and try and help raise awareness of this very important issue. And so I'll upload this. Do like and subscribe. I do these videos to help the scared people for our Facebook group Doomsday Debunk, and I help fact-checking it along with the other fact-checkers there. And as part of that, I have been following the World Health Organization. I've listened to, I think, just about every single press briefing since January 2020. I was listening to them before the Wuhan lockdown. I was finding out everything I could, because the people in our group were already scared in early January. So I've been following this right from the beginning, and everything that the World Health Organization say. I think I must be one of the few people who have listened to just about every single press briefing that the World Health Organization have given and their social media Q/As. And I strongly recommend that you follow the World Health Organization, especially their social media Q/As, question and answers, if you want to be kept well up on the latest research on COVID-19 and how to protect yourself and the top priorities we have as we work on this pandemic. And just to say, if you join our Facebook group, then to help people who are scared of many things, and as fact checker, and do read the rules at the head of the group. I'm going to do a separate video about why we have those rules and how they help the group to function, and I'll do that soon.